No, good to see you all. I'm really excited to actually facilitate this conversation with Dr. Javaid because she is disrupting women's healthcare through HerMD. And so we're going to have a casual conversation this morning to talk about her business model, what her inspiration is, and what her message is for how the importance of what she's doing is really going to change the way that women are seen and heard in terms of the agency that they have for their healthcare. So hopefully you enjoy the conversation. So I think it's important to start off with, I was inspired by you when I first met you and heard your story at the groundbreaking Women's Summit in April. And I had the luxury of sitting next to Dr. Javaid's family as she was telling her story and inspiring women at that event. And as a first generation immigrant, daughter of Nigerian immigrants, when you see the family's faces of the daughter, the firstborn, who is out breaking glass, breaking ceilings, and making change, it was so powerful just to sit and share that moment. I didn't know her, didn't know her family, but I come on the stage carrying the pride for her, for what she's going to talk about, because it is that important legacy for what difference you're going to make in the world, as to why you're inspired to do what you do. So I want to start with that for you to tell us all here what inspired you to start HerMD.
So I was a pre-med student at Northwestern, and I got a call from my father, and he said, "Somi, you need to come home." And I literally described that call as the calling for my life. My mom was actually fighting for her life. She was only 45 years old. She had been struggling with left arm pain, shortness of breath, and chest pain, and had been begging her doctors to listen to her because she had lost her mother and sister before her. But they didn't believe her because science and data could not explain why a thin, non-smoking Middle Eastern woman would ever present with four-vessel disease. She underwent emergency quadruple bypass surgery and survived. But we never got the chance to talk to her, prepare, because she literally went from the cath lab right to surgery and then came out with all these tubes. And I remember the surgeon coming out and telling me, "She looks great." Guys, I was pre-med, right? Books, not in the clinics yet. I dropped like a sack of potatoes because my brown mother was blue, and I had seen her the day before, and she looked fine. And so for me in that moment, I realized that women needed an advocate, and that I was going to change healthcare as we knew it. I didn't know yet what I had signed up for. And when I got my first job, seeing 50 patients a day, I will tell you, my idealistic face got the largest smack of its entire life. And I was like, oh, this is going to be a much bigger battle than I thought.
So with that powering your wings, and obviously that's a very important why, right? Your mother. So as you think about what you're doing with HerMD, how does the model differ from the standard operating model for what's happening with OBGYN care right now? So what's the difference that makes a difference? Because what I loved in talking to Dr. Javaid is talking about making sure that women are the CEO of their own healthcare. So knowing that, and you're stepping into the room, stepping into your care, and you talk about the importance of data, right? Data-driven decisions. And data, living in a world of AI, right? Like if you don't focus on the fundamentals of what it means to actually understand your data about you, you can't go far. And we're talking about living well and being well. So talk to us about your op model.
So the number one thing is time. Who could get anything done in a 5 to 7 minute appointment, especially when you have to get naked? Nobody. Funding, education, women leadership, these are all huge barriers to women's health care. And so longer appointment times, expertise in menopause and sexual health care. We are going to live longer, but women live in poorer health. We spend 40% of our lives in menopause, and yet we are graduating 93% of our residents with no knowledge of this life phase. I knew how to deliver babies and take care of reproductive years, which is this much. It's a splash, it's important, but this much in a woman's lifespan. I knew nothing about menopause and perimenopause. So deep expertise, and then we created a HerMD University because we were like, we have to train our existing providers now. Like, yes, medical school, yes, residency, but what about the doctors we are seeing right now? Those guys aren't going to be out for 15 to 20 years. That's great for our daughters, but what about us? Right? You and I, we were talking, we were laughing. We want to climb mountains. We want to jump off cliffs. We want to live life. We don't want to live a protracted life with illness. We want to live longer and stronger. And so the difference was longer appointment times, deep education in menopause and sexual health care, shame and stigma-free setting, female leadership, and research. Because we give women data points so that they can make a curated decision about their health care.
Yeah. And so one thing that comes to mind for me is that, especially in the world of tech and ops and innovation and all the things that I've done in my career, when you start to empower folks, I know when I've worked with employees, like, here's what it takes to actually build a thing. Now you're even smarter than you were yesterday. You have the wisdom, you have the knowledge. And at some point, people get overwhelmed with the new agency that they have. So one of the questions I want to ask of you is, so, okay, now you're empowered, you've got this information to be the CEO for your life and your healthcare. How is it that you help people not to be afraid and get stuck? Because now they know more than they knew. They're a little bit wiser, a little bit smarter, but you still have to act. So if you may.
I tell my patients to get big, take up space. Don't be afraid to ask questions. If your provider is not responding to you, is not an expert in that area, find a provider that is willing to listen to you, to empower, and to work with you, because not everyone's answers are the same. It's why women weren't included in clinical research trials until 1993, because we're too complex. It costs 10 times as much to bring a female drug to market than it does a male drug. Male procedures are reimbursed 3 to 1 right now. You guys, for the same equivocal procedure, we're incentivizing our providers to take care of men instead of women. And there's going to be 1 billion of us this year in menopause. That's crazy. That's unacceptable. That is the exact opposite of accessibility and bodily autonomy. So until we fix the insurance rates, we educate not only providers but patients, and we eradicate stigma and taboo. I go to rooms all the time and I talk about sexual health, okay? People who are having sex, their pelvic floors are healthier. They're not peeing and pooping on themselves later. Trust me, you don't want to do that when you're skiing down mountains. They have more self-confidence. They're less likely to have mental health disorders and disease. And yet we have 29 medications for men. Any idea on how many we have for women?
Show of hands. Raise them high.
Raise them. Tell me.
Don't be shy. We're not shy in this room.
Guys,
Raise
come
your
on.
hand.
This is the espresso shot. Okay. 0, no. We have more than that. Who knows what Viagra is? Right?
All right.
Addie? Anybody?
Anyone?
Ooh, okay. Amazing.
Couple of hands.
First ever female sexual health care drug approved 10 years ago. Less than 5% of providers know about it. Less than 1% of the general public knows about it. We've got to fix this.
Next question. So what are you prioritizing as you evolve the HerMD model? Like what is in the future for what you're trying to uplift and do as you scale?
Empowerment, education, and advocacy, really making women the CEO of their healthcare. And what do I mean by that? Women are very off-put when they think healthcare is happening to them. Those of us in the room, we've been in stirrups. It's not fun. But imagine if you had agency and you could be a part of that exam and a part of that decision making. So really giving women data points, helping them understand what is going on with them, and giving them providers who have been educated not only in the material, but sensitivity, right? Who is going to talk about their pelvic floor or their incontinence when your doctor is either got hand on doorknob medicine, or they're sitting there like typing into the computer screen? No one is going to talk about anything. See, I see the heads like shaking. No one's going to talk about anything personal when your provider's doing that. Ask me if I got a day of sensitivity training. None. So we do that. And so that is what I want, an empowered experience where a woman feels complete bodily autonomy and she makes an educated decision about her healthcare based on the data of today, not the myth of yesteryear. We have gate-capped hormone therapy from women, and that is one of the number one keys to longevity. We're here for longevity. You want to live longer? We're outliving our ovaries. How do we fix that? Hormone therapy.
Excellent. So I know we only have 5 minutes left because we could talk for a while, I know. But one of the things I think is important as you do the work that you're doing, and all of us in the room, anytime we're doing work, you got to stop, reflect, and tap into like what's the wisdom that you've gained from the work that you're doing. So for you, what are the lessons, like give us a lesson learned, what has surprised you before I close out on a high note?
Oh, titles don't entitle you. So for founders, don't assume other people know more about your business than you do. Always lead with mission. Remind your investors, your board, your colleagues, your employees why you're there. You're there for patients every single day. So I'm always there to lead and serve. And I would say for us, the biggest learning was pivots are okay. They're not failures. And I actually tell my children, I'm very humble. I learn more from my failures than I have my successes. Successes are fun. They're great. But we had to pivot. We thought we were going to go integrated brick and mortar and virtual, and we're going all in virtual because the bleeding heart in me, I couldn't stand that women were traveling from 35 states and 3 countries to Cincinnati, Ohio. And I was like, how can we figure this out? So we doubled down on tier 2 markets, which was great. But then we had people traveling from all over the place. And so by going virtual only, we're going to be able to hit all 50 states by next year.
That's excellent. So we're going to wrap this up really quickly, but I think I love this question in terms of what advice would you give to innovators who are looking to disrupt healthcare? And I'm going to add a ... But also the advice for women, because when you give agency the power of what it means to have that wisdom, have that knowledge, but we have to remember about there's a next gen importance there. Like it shows your kids what it means to have agency and the importance of what health means. So what is your advice?
I shared this with you, and I tell this to my staff, and I said this when they told me as a woman of color from the Midwest, and some of you all made fun of me for being the only girl from Ohio last night, but that's okay. I had less than 0.5% chance of fundraising. I had no ties to the VC world. I was older. I was in my 40s. I was a doctor. I was from the Midwest, and I've raised nearly $50 million to date. No is not in my vocabulary.
I love it.
And I shared this with you last night. My first investor check that was $10 million in less than 5 weeks was actually a hard no.
It was a hard no. That's right.
And then I wrote to him afterwards and I said, I can't stop thinking about what we can accomplish together. Mm-hmm. Hear me out. And he was like, let's get on the phone. And then 2 days later, I had a full term sheet.
Well, I cannot thank you enough, and everybody in the room for being an amazing audience, attentive. But when we hear personal stories inspired by a very personal why, it adds more meaning for why you deal with the grit and the bravery and the courage, but the passion for what you do. So on behalf of the room and everybody in the Worth team, thank you for being you and for bringing HerMD to life.
And I just want to say thank you to the Worth team for allowing me to share my story and to elevate patients and women's healthcare.
Excellent. Enjoy the day.